One.
Hello, my name is Janie Hinton, and I'm here today to talk about weight loss and bariatric surgery. According to the World Health Organization, obesity is the greatest health risk to human life. We lose more people due to complications of obesity from heart disease, diabetes, hypertension, and stroke. There is 400 million adult people that would be diagnosed with obesity in the United States alone. As you know, losing weight is not an easy task to do. So a lot of people have turned to bariatric surgery in a way to reach their goals. So today I plan to discuss the 4 types of bariatric surgeries and the pros and cons of each surgery. We'll start with the first one that has been around the longest, which is our gastric bypass surgery. And as you can see, they take a portion of your stomach, they cut it off, and they attach the lower intestines to it so you have a small pouch and your food goes through. The pros to this surgery is you expect to lose 50 to 60% of your excess weight in the first 2 years. You have more energy, of course, as you lose weight, and you have the most rapid weight loss than any other surgery. However, there are several cons to the bypass surgery. One is malabsorption issues. Because you've decreased the size of your stomach and you're absorbing and breaking down foods, you'll be on lifelong mineral replacement, which is vitamins and minerals, especially B12. You have a risk for anemia. You have to stay away from certain foods, which is red meat, because it breaks down very slowly, so you have a complication of possible blockage. Carbonated beverages, because of the gas it causes by the bubbles. Alcohol consumption, you absorb it very quickly, so they ask you to stay away from that because you can be intoxicated quicker and longer. And you can get what we call a dumping syndrome from eating too many fatty foods and high sugar foods, which just basically causes massive diarrhea. And this is a non-reversible surgery, so it is permanent. The next surgery you'll see is the gastric sleeve surgery. And as you can see, they cut out part of the stomach, they staple up and do the same approximately as the other surgery, the gastric bypass. The pros to it is it also restricts your food intake, as does the gastric bypass. 50 to 60% of your weight is lost in 3 to 5 years, which is a little slower than the bypass. Your post-op is only 2 to 3 days, max 2 to 3 days in the hospital. Cons are going to be similar to that as the gastric bypass surgery. It is a permanent procedure, non-reversible. You do need the vitamins and mineral replacement, and you can have more early complications with this surgery, such as severe nausea, vomiting, and gallstones. The third surgery I want to talk about is the gastric lap band. And as you can see, it is a band that they surgically put around the top of the stomach to make a pouch. A tube comes down and there's a little port that sits underneath the skin. In the skin, the physician can access it and add or take out fluid as needed, depending on the amount of weight they want you to lose in a month. The pros to gastric is it is a lower rate of complication. It is a hospital stay of less than 24 hours, and it is reversible and removable. So once your weight you have lost, you can have this procedure, the things removed. The cons of the gastric lap band is the least amount of weight loss than the other surgeries. It is a foreign object, so your body could reject it or try to reject it and have to be removed. And there is a risk of gastric slippage or flipping of the band, which will cause gastric erosion, and you would also have to have this removed. The fourth and final type of bariatric surgery is what we call the gastric balloon. It was just approved in the FDA in 2015 for use in the United States. This is a simple procedure. As you can see, it's 2 balloons. You would come in, get sedated. They would go down and put these balloons in your stomach, and it would just float around in your stomach. And what this does is when you eat, of course, make you feel fuller as well. This is PROS. It only takes a few minutes. It's done in an outpatient surgery or ambulatory surgery setting. It's only in place for 6 months. It's easily removed the same way. It goes in, it comes out, you go down, you get it, you come out. And it's only $7,000 to $8,000, so it is the most reasonable cost of all the bariatric surgeries. The cons, however, is insurance does not cover it, so this is 100% out of pocket. The device is left in the stomach, so you could also run the risk of rejecting this device as well. And of all the surgeries, you lose the least with these. You can also have severe nausea and vomiting for several days post-procedure. As with all these bariatric surgeries, it's always good to remember that you must continue to diet and exercise, because over time, the pouch that they've made with these surgeries does increase. And if you overeat, you will increase it more. In this presentation, I've given you the 4 types of surgeries in hopes, if you are considering one of these surgeries, that you'll consult with your doctor and pick the right surgery for you. Thank you. There's my references.